Welcome to In Focus with Ejaz Haider. Our top story tonight is about the reiteration by Turkey's President Recep Tayyip Erdogan of Ankara's clear position on India's occupation and illegal annexation of Kashmir. In a phone call between President Erdogan and Prime Minister Imran Khan to greet each other on the occasion of Eid al-Adha, both leaders reaffirmed the close and traditional relations between Pakistan and Turkey, a partnership that both states consider very important and which is multifaceted. President Erdogan also stated Turkey's principled position on Kashmir, which has been under India's illegal occupation since partition and which India illegally annexed on 5th August last year. Prime Minister Khan thanked President Erdogan for his support on the Kashmir dispute. Both leaders also discussed cooperative strategies to battle Covid-19 virus. Turkey and Pakistan has a long history of cooperating in various areas, including taking similar positions on issues of importance to both sides, issues related to and impacting the Muslim states, trade, investment, and military-to-military cooperation. To discuss the close ties between the two states and the challenges they face in a fast-changing world, we have with us Haroon Shaukat, a former ambassador, diplomat, who's also our ambassador to Ankara. We also have with us Temel, who's the CEO of Turkish Aerospace Industries, and Ms. Ravale Mohydin, who currently works as a researcher at the TRT World. Thank you to all panelists. Before I go to the discussion, a couple of interesting things in relation to military cooperation. It's actually been increasing over the past 8-9 years. There's also a high-level military dialogue group which is supposed to further this relationship. We were also looking for attack helicopters from Turkey, T-129. These are the advanced attack and reconnaissance helicopters. There's a slight problem with the engine because the engine is American, and so the Turkish aerospace industry is trying to get a license from US authorities to export the helicopters to Pakistan. Turkey is also getting the MF-I-17 Super Mashak aircraft from Pakistan, Trainer aircraft. There are a number of other issues there. For instance, Pakistan Navy has commissioned a 17,000-ton fleet tanker, which has been built in collaboration with a Turkish defense company. Ankara also won a multi-billion-dollar tender to supply 4 corvettes to the Pakistan Navy in what has been described as the biggest ever export deal in the Turkish defense industry's history. But as I said, this is multifaceted. So let me go to Ambassador Shaukat here first. Ambassador Shaukat, give us a sense of the closeness of the relationship between Turkey and Pakistan, and of course the various facets that I talked about in my opening.
Pakistan and Turkey enjoy very deep historic and cultural relations, steep in common faith, same history, a history of mutual support on crucial issues like Pakistan supporting Turkey on Cyprus, Turkey always standing by Pakistan on Kashmir. We've had a strategic partnership going with Turkey, and I think this relationship is expanding every day. We have a very solid economic collaboration between the two countries. The military-to-military cooperation is almost exemplary. What is important is the belief of the two leaderships. The two important countries in the Muslim world, both Pakistan and Turkey, occupy a leadership role in the Islamic world, and they are a factor of stability in the larger region. And this larger region, I would include, even the Middle East in it. And there's a keen desire on the part of the leadership to strengthen each other so that our reliance on other countries is lessened. As you know.
Right. It's interesting that you talk about the economic cooperation. According to figures, there are 17 Turkish companies in Pakistan, while 233 Pakistani companies operate in Turkey. The trade volume between Pakistan and Turkey has increased from approximately $600 million to $800 million over the last 5 years. This is still not up to its potential, but as I said, this is something that both sides are looking at in order to enhance the trade volume and also bring on the potential for defense cooperation to increase it further. Let me pull in Mr. Temel Kotil here. Mr. Kotil, you are the CEO of TAI. I talked about the attack helicopters. Can you give us a sense of where the situation stands?
Yeah, actually, we have several helicopter programs existing. The indigenous one is the 5 of them. The things you talk about is the attack. And still be working on the engine. In your knowledge, also Turkey building this similar engine for the future helicopter programs. And helicopter is very important for Turkish the securities because of the mountains, and Pakistan is the same way. Hopefully, we're gonna solve and deliver that the third helicopter to Pakistan, and also really we're trying to do more thing in Pakistan, and not only the 129, they're building 625, 629. One is the 12-seaters, others the attacks, and the larger one. I don't have maybe too much time talk about helicopters, but two great nations, Pakistan and Turkey, we should work together. You know.
I also said, Mr. Kotil, that, and this is based on analyses coming out of Pakistan as well as Turkey, experts who say that the potential is much more than what we have right now. Give me a sense of how you would look at it in terms of what more can be done in terms of this kind of cooperation.
I visited your site several times. You have the PAK camera, which is similar to the company I'm running right now, and to Pakistan and Turkey. And they have the similar strength in terms of building the fixed aircraft. They're building the fixed generation fighter right now, actually. And the first flight is 25, rollout is 23. Or as I said, between Pakistan and Turkey, we have similar technology, we have auto peoples, and we need to cooperate. And you mentioned that maybe less than 100 companies working from both countries, but my suggestion is there should be 1,000 in Turkey, 1,000 in Pakistan from Turkish side. In your knowledge also, we have office in the National Science and Technology Universities, and we are Technopark there. There are a lot of things we should be doing, just we are in the beginning, you know.
Just repeat that. I want to make sure that I've heard that right. So you're saying that your company also has offices in the NUST universities in Pakistan? Is that correct?
Exactly. It's one of the greatest universities on the Asia Pacific. I like it, and we're cooperating, and also in the summer we have students from the NAS, and we're sending our engineer to the NAS also. Really, we have a good link, and we have a nice office there, and also have a Pakistani, the employees, nice people in Pakistan. We have a big vision for Pakistan.
Great, I'm very happy to that. Let me go to Ms. Mohydin here. Ms. Mohydin, now, give me your sense of these relations. Also because we are probably an older generation, but given your generation, how do you look at these relations, and do you think there is a potential to increase cooperation between Turkey and Pakistan?
Thanks for having me. First of all, I don't think that we can talk about the future without considering the past. We do have very long-standing relationships with Turkey. Pakistan has had a very long-standing relationship, ranging from issues with support on Cyprus, support on Kashmir. July 2016 coup attempt in Turkey was completely, it was not at all supported by Pakistan. Turkey has been supporting Pakistan on multiple platforms, including on FATF, in the Nuclear Suppliers Group. So there have been multiple aspects of cooperation and support, and that has, there are key motivations for that. One of them being that there is a changing geostrategic importance of both countries in the world. right now. And we also see that despite the fact Pakistan and Turkey have enjoyed very, very strong state relations, and not just based on passing government, but actually strong relations between state institutions. So that has made a very strong base on which to build any future cooperation or any future relationship. So sure, we cannot look at the future without looking at the past. For example, previously, Turkey, more than 2 to 3 decades ago, was very, very inward. They were pro-Europe, looking at the European Union always. Now, as time has moved on, you see Turkey looking beyond the US, beyond the EU, which is they are facing their own problems. Turkey wants to move beyond these previous relationships and open up to the rest of the world, to the Middle East, to Asia. Pakistan has positioned itself as a very, very strategic partnership in Asia. It offers extensive influence in the continent. Pakistan has become a mediator between Iran and Saudi Arabia. Pakistan has a key role to play in Afghanistan. Pakistan has a close relationship with Saudi Arabia, has a close relationship with the rest of the Middle East. So, and of course with China. China is very much a part of the conversation with Pakistan. So given all of this, what is translating now in the future is that we have excellent military cooperation, which has been continuing from decades. We have growing economic cooperation. From $800 million, there talks of increasing this up to $5 billion of bilateral trade. We're looking at increased people-to-people ties. I mean, Ertugrul was a phenomenon in Pakistan right now. It's become a very big part of the cultural connotation in the country. Then you have coronavirus, which showcased a lot of the support that Turkey and Pakistan gave to this. There was a lot of technology transfers, which allowed Pakistan to actually develop indigenous ventilators. That technology transfer was from Turkey. So, are you saying that, the strength of Turkey-Pakistan relationship actually is bringing the past into the future, making sure that whatever the basis of trust, the basis of our relationship, we continue with that into the future.
Absolutely. And Shaukat, Ravale has made some very interesting and important points with reference not just to the fact that past and present and future are one continuum, but also she's talked about, as I also mentioned, the future challenges in a changing world, the changing nature of the geostrategic nature of the world, the new realignments. She's also spoken about Turkey's, look east policy. Give me a sense of, when you were there representing Pakistan, were these changes already happening? Were they, you could see that Turkey was going towards that side?
Well, I think this has been going on for some time. The policies adopted by the government of President Recep Tayyip Erdogan, they've always widened the canvas. Since the turn of the century, Turkey has grown at a very consistent pace. Turkey has become a member of G20. Turkey is a very important player in the Islamic world. What is important in the context of bilateral relations is that the political will to strengthen relations exists. Frameworks exist, but I think a sharp focus needs to be brought on the economic collaboration, which is the core of security in many ways. We have good cooperation going on in the military field, in several other fields, but I think in the context of economic collaboration, the sky is the limit. Turkey is the second largest player in the construction industry. Turkey is a very major player in the tourism industry. Turkey is a very major player in the aviation industry, just to name some. I would not to forget their great breakthroughs in livestock and dairy. The point is that we need to use to the full the existing frameworks which exist between the two countries, the political goodwill that exists between the two countries to actually now concretize this economic collaboration, which can actually multiply several folds in very short period of time. Why it is not happening? There are a few glitches. There are issues of the enabling environment in many ways, but I think this is an area which needs much greater and sharper focus. Trade is also very limited. Even a 1 billion mark, I think, was the maximum that we achieved in bilateral trade, which is very sort of minimal in the current scenario. But Turkey can actually jumpstart Pakistan's economy. Their construction industry is phenomenal.
I think that these are very important points. I completely agree with you that the area of economic cooperation, trade and investment, of course, are very, very important areas. On the political side, just to apprise the viewers, President Erdogan has had 10 state visits of Pakistan. He's the only foreign leader to have addressed the Pakistani parliament 4 times. And this was the last one was earlier in February this year. I have a statement by Jamal Demir, who's the head of South Asia Strategic Research Center, who's talked about the Turkish defense industry's cooperation and has pointed out areas: aviation, space, arms, ammunition, military vessel construction, military vehicles, electronics, and military clothing as the main areas of cooperation in the defense industry. Before I wrap up the segment, let me go back to Mr. Temel Kotil here. Mr. Kotil, can you identify those areas where we can essentially improve cooperation, and what are the glitches that Ambassador Shaukat talked about in terms of not having the right kind of enabling environment to actually fulfill the potential of these relations?
Just I want to say a couple of things why Turkey is nowadays very successful is. And recently, the defense industry directly reporting the president. So this is the defense industry presidency has a direct link there. Also, there is a special fund for the defense industries. And all that companies, myself, Turkish Aerospace, Roketsan, Aselsan, all that private, we're making ecosystems. From the missile to from the helicopter, aircraft, submarines is coming from like a single point, directed the president. That's a good example. So all that companies include Turkish Aerospace, Roketsan, Aselsan, they should be work very close to the Pakistan counterpart. You have really good infrastructure. You have wind tunnels. We're building the wind tunnels. Maybe we need to share them, And you're building also a new technology center on the Canberra. We are willing to be there. Coming back, actually, in order to enjoy, they utilize all that possibilities. There should be a moment on the grassroots level. The student exchange is very important, Universities, they need to work together. More tourists should come together. What I'm seeing, hopefully, very soon, Pakistan and Turkey will be a superpower. And it will stabilize, Pakistan stabilize, the Asia Pacific, Turkey stabilize, inshallah, on the Middle East and so on. And I'm trying to make him short, but there are a lot of things. We can work on the fixed wing, the helicopters, we can work on the missile system, whatever you think about it, because we have everything in Turkey and you have everything in Pakistan, and there should be more relation, more works. And as I said, the engineering level, student level, the project level, we have the fighter program, 5th generation, we have the Hürjet jet trainer, we have the turboprop, you have Super Mushak, There are 1,000 things and that number should be get as 0 on the right. We call this one, everything should be increased 10 times, inshallah. 10 times, that time we...
Absolutely. Final question to Ravale Mohydin. Ms. Mohydin, media-to-media cooperation, I remember on the sidelines of the UN General Assembly session last year, it was talked about Malaysia, Turkey and Pakistan creating a television channel, an international television channel. Is there any progress on that?
At this point, I think the main way in which we could potentially continue this conversation and continue the progress on this is that instead of having a channel per se, we could potentially have a collaboration where we train people who are journalists, people who are editors, newsroom leaders, talk to them about how we can actually present Muslims, present Islamic countries, present the Middle East as a region, South Asia as a region, areas of concern for Muslims. That was supposed to be, this particular channel is an idea. Implementation of this is something which we can all work on it in different ways. One of the ways in which we were doing this, the Kuala Lumpur Malaysia Summit was supposed to be another way in which we could have a platform to discuss our issues, the Muslim world's issues, presented to the world. And along with such events, we need specific training centers for journalists across the world.
That's a very good idea. I'm sorry, I've just run out of time, but thank you so much for your insights. Ravale Mohydin, thank you. Mr. Temel, Kotil, thank you. Ambassador Haroon, Shaukat. We shall take a short break and return to discuss the continuing spread of COVID-19, as also the flattening of the curve in Pakistan. Stay with us. Welcome back to In Focus. Our second story tonight is about COVID-19 virus, the pathogen that continues its deadly march. While some countries have begun to see a decline in cases, others are still battling to control and flatten the rising curve of cases. On 29th June, the World Health Organization marked the first 6 months of the pandemic and extended its alert for another 3 months. In South Asia, while Pakistan and Bangladesh have seen a decline in cases, India continues to see cases rise. No one really knows how this works. Of the top 10 countries still battling rising cases, 7 are upper middle income or low middle income countries as defined by the World Bank's assessment of income, and 3 are high income countries. To discuss this further, we are joined by Emily R. Smith, who's an epidemiologist and an assistant professor at the George Washington University. We also have with us Dr. Javed Hayat Khan, who's a pulmonologist, joins us from Lahore. Let me begin with Professor Smith here. Professor Smith, it seems that there's still lots of unknown unknowns, so to say. One doesn't really know why it impacts person X differently from person Y and person Z. So just give us a sense of what it is that in terms, there's a lot of detective work, frankly, involved in this, to put it in a way. What is it that we now know for certain, and what is it that we don't know?
You're right. There are many medical things that are uncertain where we're doing a lot of work. But what we do know works are several things. We know that avoiding crowds and reducing group gatherings and avoiding other people can reduce the risk of transmission. We know that washing your hands is important. We know that face coverings or face masks are part of the solution. And so there are really a number of public health interventions that can reduce transmission. And in countries that have been successful, that's what we're seeing is clear government strategies to help reduce the spread of COVID. In terms of what we don't know, there are still a lot of unknown or unanswered questions that people are working diligently to find answers to. And this This is related to medical interventions about the prevention and treatment of COVID, of severe COVID disease and preventing deaths. And so we've seen some successes or some good news come out of the clinical trials in recent weeks, and that's great. And there's still a lot of work to do. But right now, our focus has to be on preventing cases, on preventing the spread.
Absolutely. I agree with you. As far as breaking the chain is concerned, there are a number of things that we do know now, and local governments and central governments are trying to enforce those. But a layperson question, what is more important in terms of understanding this pathogen? Is the people who are badly impacted by it, and which can also cause mortality, or the people who have fought it off successfully, very often asymptomatically?
We can learn a lot from both. So from a medical discovery perspective, understanding why certain people are better at battling the disease, that helps us to understand things like how a vaccine can be developed successfully. Understanding why people respond poorly, who are hospitalized or even die, understanding those cases can help us understand what types of treatments might be effective. So from a biological perspective, both of these things are important. From an everyday prevention perspective, I'm not sure it matters much. We have many diseases, all diseases really, where people respond better or worse, and nonetheless, prevention remains important for everyday people.
So those who develop symptoms and also ultimately where they have to be hospitalized or put on ventilators, are these cases essentially of people who have comorbidities, or have we also come across people who are otherwise young, healthy, but still have responded in a negative way to the virus?
There are certain things that put people at increased risks. So, for example, people who have a higher weight, who are obese, are at increased risk. People with a heart condition or an immune condition are at increased risk for a bad outcome related to COVID. But we still have many people who are perfectly healthy and for no reason that we know of are having bad outcomes related to COVID, even in kids. And so right now we can't predict what it is that makes people respond better or worse.
Now, a final question, Professor Smith, before I let you go. We keep talking about herd immunity. Now, a herd immunity seems to assume that a certain percentage of people will get infected, and ultimately the population will become immune to the virus. But we're basically saying that lots of people will die, lots of people will get hospitalized. So that's one thing. So there's also a bit of the moral hazard issue here. Secondly, does the virus actually become weak in order for a population to get herd immunity?
So herd immunity means that there are enough people in the population who are no longer susceptible to the virus. So it doesn't mean necessarily that the virus is changing. And in fact, we've seen very little change with this virus over time. It seems quite stable as compared to something like the flu, where there is a lot of changing of the virus itself over time. So we're not seeing so much of that with SARS-CoV-2, the new coronavirus. Herd immunity is just enough people have it so that it's not spreading so quickly. One of the reasons we're seeing this really fast spread is because everyone is susceptible. Now, the big problem with this herd immunity strategy is it seems that we're very far from achieving that, first of all. Even though we hear about COVID every day and it feels like cases are rising quickly, we're still, it seems, quite far away from herd immunity. And as you said, achieving herd immunity would mean really an untold death toll and really consequences for the economy, for our healthcare sectors, for our healthcare workers. So for all of these reasons, herd immunity isn't a good strategy. And there's a third problem with herd immunity is that we still don't understand how immunity works exactly for this new virus. And so it's a really risky bet to say that we'll become immune and never get the virus again while we still don't know. We're only 6 months into learning about this virus, and so we can't know yet about long-term immunity. And so that's a third reason I think it's a really risky strategy.
Absolutely. Thank you so much. That was Professor E.R. Smith speaking with us. Let me go to Dr. Javed Hayat Khan. Dr. Khan, we have seen the number of cases decline after a spike in June. Is that because the social distancing and other measures have been working?
Yeah, absolutely. I think it's very fascinating observations that we peaked in the middle of June, and everybody at that point was predicting our worst case scenario, looking at the modeling of Imperial College, that we were going to get something like 30,000 deaths a day. And WHO was warning us as well. And then something happened. Immediately, we saw now 80% to 90% decline in cases, almost whatever parameters you want to use it. There are many factors, probably one can postulate in the context of Pakistan. Of course, there was a lot of campaign of the prevention, cutting down the transmission by wearing the face masks, social distancing. And I think one interesting phenomenon related to Pakistan was a smart lockdown. Initially, people thought how it's going to work, but it really worked. We must remember that we have a very trained polio team which know almost every street in every city. So they were very handy. They could point out exactly this particular street in this particular locality is most people have been identified. You could just lock down that street rather than the whole locality.
So you said this is a very interesting thing saying, Dr. Khan. So you're saying that the mechanism that we used for polio vaccination is the mechanism that we also employed for detection of coronavirus and identifying streets and the areas which needed to be smartly locked down.
Precisely, that's the observation, because no one has so much trained staff on ground as Pakistan has for the polio vaccination. So that what they were used for this strategy, and it appears to be working. And in the other phenomena, like we have the young population as compared to the others, but again, the other economy has the same younger population. Our average is 22 in Pakistan. We don't have the elderly population. And the third, probably the factor is majority population is female, and they don't go very often outdoors. So the outdoor are the youth, male, active people who are outside. But I think you can talk about too many factors, but I personally think this strategy of closing down individual streets and individual localities based on experience of the polio team has probably helped us along with the usual preventive measures, face masks, social distancing, etc.
Okay, Dr. Khan, stay with me. I'm also joined by Dr. Srinivas Rajkumar, who is with the All India Institute of Medical Sciences in New Delhi. Dr. Rajkumar, thank you for being on the program. So I was talking about, there's so many interesting questions and also vexing questions, frankly. In terms of genetics, I'm assuming as a layperson that there's not much difference between the population in Pakistan and in India and also perhaps in Bangladesh. But give me a sense of why is it that Bangladesh and Pakistan are witnessing a flattening of the curve, whereas India's curve is rising. Now, before you joined me, Dr. Khan was talking about smart lockdowns and all that, but my sense is that that's exactly what the Indian central and state governments also did.
The very scale of India, having the second largest population in the world and having a vast expanse of land from north to south, east to west, makes it more prone to have a prolonged pandemic. So India is supposed to have peaks in different parts of the country, in different cities at different times, and the flattening will be slow to happen. So some cities like Delhi have already flattened the curve. Chennai is has almost flattened. But considering, for example, to make sense of the magnitude, the population of Pakistan is just 2 times of Maharashtra. So considering the vast magnitude of the country, and we had a very prolonged lockdown, which delayed the onset of the pandemic. So obviously it will be late to fall, but other measures are well in place, and there is also like increased focus on home-based care, having COVID care centers. So there is good progress, and some states which are not able to handle are imposing lockdowns on a need-by-need basis. So the key is to open up, have lockdowns when the health facilities are not able to cope up, and learn how to manage on the go.
No, I perfectly understand that you're making in terms of the size of the population and the diversity. I understand that. As a matter of fact, you talked about Pakistan's population twice the size of Maharashtra. UP is a better example, perhaps, because UP's population is a little less than that of Pakistan. But here's another question. I was talking to Dr. Khan also, and earlier to Professor Emily Smith. What do we know about how and why the virus impacts different people differently? We know about comorbidities and the rest of it, but there are lots of cases of young people who have been, laid waste by this virus, whereas the older people who were either asymptomatic or just had, minor symptoms and pulled through.
Everybody is vulnerable, but some population are more vulnerable than others. And we know that in the initial part of the pandemic, countries which had to face the brunt initially had a higher mortality rate. But with the learning that came from the treatment, particularly use of steroids and access to ICU facilities, access to simple oxygen, which has improved over time, has led countries which were late to have the infection manage the pandemic well. So that is what we can make sense of from the current performance of even countries with very poor human development index able to manage the pandemic well. For example, like as you say, Pakistan, then again India, some cities of India, then again Bangladesh, or be it like other countries which are able to manage well with very limited resources, just shows that the experience we have been able to accumulate, analyze, and propagate by the access to like modern means of communication has helped us manage the pandemic better.
Okay, stay with me, Dr. Kumar. Let me go back to Dr. Khan here. Dr. Khan, since there is no vaccine, give us a sense of what are the standard ways of treating a COVID-19 patient, especially someone who's showing symptoms and who's likely to get hospitalized and perhaps, essentially, in terms of going on to the ventilators and oxygen and the rest of it. So what is it that you're doing in the absence of a vaccine?
Well, as mentioned earlier on by the other guest, over 6 months we have learned a lot, and the mortality generally has now much lower than it used to be at the beginning of the pandemic. We did learn from several studies. We did learn when to intervene and what the red flag signs, what can be called at. So I think there are still a good number of patients, 30-40%, who do not have any symptoms at all. We still continue to see those patients. Just incidentally, you find them out in testing and in isolating at that period. And then there are people who do have just respiratory symptoms. But what we did learn from autopsy studies and how this virus is behaving, what it's causing in the body. And there was one interesting term coined, which is called happy hypoxia. That means when somebody's oxygen drops, normally somebody's oxygen drops, so they become symptomatic. They have symptoms, they are short of breath, they have a difficulty in breathing. But in this COVID, what was happening, the patient does not know at all that his oxygen had dropped to the critical level. So he never had any symptoms. It was called happy hypoxia. So the thing which we learned that earlier you identify those patients, the better the outcome would be. how you identify the markers, the inflammation, what is called the hyperimmune response, which we did know now, which happens in those patients, even the time frame that it happens after 1 week of your sickness symptoms, and then 5 to 9 days are very critical. So I think the medical community learned that these are the specific, the period time frame in the course of the illness where you need to intervene. You need to be very observant. And also, you may have seen in our country, the people have multiple oximetry and keeping at home. So there was a lot of campaign, a lot of education, and for the public, for the patients, and for the healthcare professionals, which helped collectively in getting to this stage. We know the vaccine is not around the corner, and it may not be for a foreseeable future, but still the emphasis is on prevention, cutting down the transmission, and identifying those patients who are at risk of getting a severe disease. Another thing happened that very early on, the management, for example, the people who are on the ventilator, we learned in this pandemic, they are behaving differently than the other influenza pandemic, which we have seen earlier on. So the strategy was changed. It changed towards giving more oxygen, for example, and using high flow oxygen or using non-invasive ventilation than invasive ventilation. So I think over a period of time, the world learned from each other's experience. And that's
very interesting. That's interesting. I am also running out of time, so quickly back to Dr. Rajkumar, and a quick response, Dr. Rajkumar. What Dr. Khan is saying is that also the learning trajectory you've seen in India? Is it more or less the same, or are there any other observations?
Absolutely. Now we are learning as a world rather than as countries individually. There is more collaboration than ever, possible through global agencies like the World Health Organization, which we are participants, and we are learning from the experience, and it has been successfully implemented. As Dr. Khan summarized well, that we have provided pulse oximeters for home-based care, and regarding the happy hypoxia and other aspects of the illness, widespread use of sanitizers, hand washing, masks. So the experience has been almost the same, but considering the geographical differences, we will have a prolonged pandemic, but we will recover, and finally the results would be
okay,
better.
Great. Thank you so much. That was Dr. Srinivas. Rajkumar. Thank you to Dr. Javed, Hayat Khan. This is all from In Focus tonight. We shall see you tomorrow at the same time. Keep following our latest updates on social media at indus.news. Good night and goodbye.